Today, the topic is about community pharmacy. Community pharmacy. It is a type of pharmacy that are privately owned and whose function is to serve the patient needs for both drug products and pharmaceutical services. Functions of community pharmacy, that is prescription handling, patient counseling, patient medication record, pharmacy administration, compounding, providing health information to the patient and public. Prescription. A prescription is a written order from a healthcare professional, typically a doctor, that authorized a patient to obtain and use a specific medication or treatment. It usually includes details such as the drug name, dosage, and frequency and duration of usage. Okay, the next part is that is the part of prescription. First one is prescriber information. It includes the name, qualification, address, and contact detail of the healthcare provider. Writing the prescription. Patient information. It includes the patient full name, age, that is the date of birth, or and gender, and sometimes weight, especially for pediatric patient. And date. Date means the date the prescription was written, which helps in verifying its validity. Superscription, the symbol Rx, indicating that it is a prescription. Inscription, the main body of the prescription containing drug names. It should be generic or brand. Strength of or concentration of drug. Dosage form, that is tablet, syrup, or injection, etc. Subscription, instruction to the pharmacist on how to prepare and dispense the medication. That is example, number of tablet, quantity of liquids. Signature, that is direction for patient specifying. Dosage, how much to take. Dosage, how much to take. And route of administration, that is oral, topical, inhalation, etc. Frequency and direction. Example like take one tablet twice a day for 7 days. This is the example. Uh, Yet one is refill information. It specifies if the prescription can be refilled and how many times. And also prescriber signature and registration number ensures authenticity and legal validity. 10th and last one is that is warning and additional instruction if necessary. Special precautions such as take with food or do not drive after taking this medication. Next. Patient counseling. Patient counseling means doctor will interact with the patient. They will provide information to the patient about the drug, its usage, and what is the side effects it will come, and how it will help to the patient in treating that disease. Now definition. Patient counseling. It is the process in which a healthcare professional, typically a pharmacist or doctor, provides information, advice, and assists to patient about their medication and health condition. The goal is to ensure safe and effective use of medicines and promote better health outcomes. Steps. Steps in the patient counseling. First one is introduction and rapport building. That is, first greet the patient and introduce yourself. Create a comfortable environment for discussion. Second one is assess patient knowledge and needs. Ask about their understanding of condition and medication. Identify concerns or misconception. Third one is after that provide medication information, name, purpose, and benefit of the medication, and dosage, route, and duration of treatment, possible side effect and how to manage them, storage instruction, and handling precaution. Next, fourth one is address patient questions and concerns. Encourage the patient to ask questions, clarify doubts, and correct misunderstanding. Fifth one, uh, check for understanding. Ask the patient to repeat key instruction like teach back model method. Confirm they understand how to take their medication properly. Sixth one is provide lifestyle and health advices. First one, recommend diet, exercise, and lifestyle changes related to the condition. Advice on factor like alcohol consumption, smoking, or stress management. Seventh one is follow up and monitoring. Inform the patient about follow up visit if needed. Encourage them to report any adverse effect or problems. Next one is inventory control. Inventory control, it refers to the process of managing and regulating stock level of product, especially in industries like pharmaceutical, retail, and manufacturing. The goal is to ensure that the right quantity of stock is available at the right time while minimizing cost and waste. Methods of inventory control. First one is stock management techniques, that is ABC analysis. It will categorize inventory based on value and uses. First, A item means high value, low quantity. B item means moderate value and quantity. C item means low value, high quantity. VD analysis. VD full form is vital, essential, and desirable. It is used for medical and pharmaceutical inventory. FSN analysis, that is fast moving, slow moving, and non moving, helps in stocking based on demands. Second one, stock level management. Minimum stock level, the least quantity that should be available. Maximum stock level, the highest quantity allowed to prevent overstocking. Reorder level, the percent at which new stock should be ordered. Safety stock, extra stock kept to avoid shortage. Inventory tracking system is perpetual inventory system, that is real time tracking of stock. Periodic inventory system, stock is checked as a specific interval. Barcode and RFID scanning, it is nothing but technology for efficient inventory monitoring. Fourth one, economic order quantity, EOQ, a mathematical formula that determines the optimal order quantity to minimize cost related to purchasing and storage. First in, first out, FIFO, and last in, first out, LIFO. FIFO means older stock is used first, that is important for pre-savable goods like medicines. LIFO, newer stock is used first, used in certain industries for cost advantages. Communication skill. Communication skill refers to ability to convey information effectively, clearly, and appropriately in different stages. Good communication is essential in personal, professional, and healthcare interaction, ensuring understanding and collaboration. Types of communication. Verbal communication. Using spoken words face to face, phone calls, presentations, that is verbal communication. Non-verbal communication, body language, facial expression, gestures, and eye contact. Written order, emails, report, prescription, and documentation. Visual communication, using images, graphs, or videos to convey messages. Thank you. Date.